The Ministry of Health is developing advocacy messages targeting the youth with the aim of improving their access to sexual and reproductive health services. According to the ministry's senior programs officer in the Division of Reproductive and Maternal Health, Mr. Martin Mburu, they are currently pre-testing the key messages that seeks to address key issues of sexual reproductive health, including gender-based violence, HIV and AIDS, together with maternal and neonatal mortality rates in the country.
My name is Martin Mburu. Martin Mburu is a senior programs officer working with the Ministry of Health, Afya House, Division of Reproductive and Maternal Health. And we are glad to be in Siaya County. And the purpose of us being here in this county, we are pre-testing the key messages that are targeted to young people and the community at large, which is addressing the key areas of reproductive health, including SGBV, that is the sexual and gender-based violence. It's also addressing the HIV AIDS, and also we are addressing the key messages towards elimination of maternal and child death, that is child mortality, perinatal death and maternal mortality rates. And this is the first county that we are pre-testing our messages that we started them. We started to develop these messages early 2023, that is around March. And we are targeting to pre-test in the 4 counties before we roll it out to the entire nation. That is Siaya County is the first one. Then we'll move to Mombasa, go to Garissa, and eventually in Nairobi, whereby towards the end of this year, we are looking forward to be able to finalize and also to validate these messages so that they can be used in the whole country. We're also looking these messages to the right holders, who are the young people themselves, the challenges they go through, and what kind of address they would like for them so that their issues can be addressed at all levels, from the community all the way to the highest office of the land.
My name is Gladys Kio. I work for African Gender and Media Initiative Trust as Executive Director. We are a women's rights organization, and part of the work that we do is to advance the reproductive health and rights of girls and women. What we are doing here today is we've been on a journey since last year of doing consultations collaboratively with young women and duty bearers, specifically the Ministry of Health, the Division of Reproductive Health, and also involving counties like Siaya County, Kilifi County, Garissa County, Mombasa County, working with those duty bearers to address the issues, the reproductive health issues that are facing young women. And also adolescent girls. One of the things that you might be aware of is that we have what is being called now the triple threat: HIV, GBV, and teen pregnancy. And actually it is now going to triple threat plus, because there's also that those 3 issues are also coming with their own challenges with regard to mental health. So to address those challenges, we asked ourselves as an organization, and also with the partners that we are working with, what is it that we can do to improve the reproductive health outcomes among adolescent girls and young women? Boys included too. That so when we asked that question, we said we need to communicate better, because we have health facilities, we have health workers, we have the young people, but we still have this negative health, reproductive health outcomes. So one of the things that we identified is the need to create awareness, the need to communicate better in the sense that the recipient of that message appreciates the situation and what we are asking for.
My name is Lona Nyandat. I'm the Executive Director in Women Empowerment CBO, NYECBO. So today we have partnered together with GEM Trust, Ministry of Health national level, and the Ministry of Health, Siaya County, and we've been able to have a meeting, we convened a meeting where we've been talking with the young women in their diversity and developing messages, pre-testing them. These messages are geared towards ensuring that health access among young women in their diversity is improved, and especially adolescent girls and young women. So we have noticed a gap where the health-seeking behavior of young women has not been very promising, and especially in Siaya County when it comes to issues and matters around sexual reproductive health. So we have convened today together with young women from Siaya County to look at these messages. Do they really resonate well with the issues that affect us as young women in Siaya County? Will they be messages that would encourage us as young women in Siaya County to access services? So that is what we have done today, and we're looking forward to cascading this because we are still going to have meetings in other counties like Garissa, Mombasa, and Nairobi, and after that the Ministry of Health national level will then print these messages, and these messages would be used nationally among all of us, all over the country by the young women. And these messages are geared in different platforms, that is social media, print media, and even the old media, to ensure that the Ministry of Health, and specifically those counties that I have mentioned, are able to increase the young women's health-seeking behavior when it comes to matters reproductive health.
I'm Pamela Josephine Anyango. I coordinate reproductive health services within Siaya County. And we are glad that today we were working on a validation and pretest of SRH advocacy messages. These messages are geared towards the right holders. The right holders are the community members. The information being passed to them will be that if they need any service, they're free to get accessible services across all our health facilities. These advocacy messages also targets the policy makers, that is both the national government and the county government. What are some of these things that we must put in place to ensure that we have access to SRH messages among adolescents and young people? Then these messages also are targeting, the advocacy messages are also targeting the healthcare providers. In what ways can we provide youth-friendly services within the county to ensure that we deal with the issue of triple threat plus, that is the issues of teenage pregnancies, the issues of sexual and gender-based violence, and the cases of new HIV infection among the adolescents and young people also, taking into consideration that mental health is also an issue within the county.
You are watching Royal Advanced Net TV.